Forever chemicals, also known as per and polyfluoroalkyl substances, we often know them as PFAS. Well, they're a group of human-made chemicals that are resistant to degradation in the environment. Hi, I'm Dr. Mitch Ghen, and I want to go over some of these things that are important to eliminate or to be aware of. Now, these are a class of chemicals used in as many as 88% of household products, especially those that have a non-stick component, a stain-resistant, and perhaps a water-resistant treatment. Widely used because of the unique properties, including this water, oil resistant, and heat resistance, and the stick properties. Forever chemicals have been found and persist pretty much. They don't break down. They accumulate in our water. They accumulate in the soil, and even living organisms begin to take them up. PFASs have been detected in human exposure. These chemicals occur through ingestion, inhalation, or just plain skin contact. Forever chemicals can cause developmental and reproductive issues, liver damage, immune system damage, dysfunction pretty much to any organ system, and even increase the risk of cancer. So the thing is, if we're aware about these, what can we do about them? Well, we have to identify first where they are present and avoid them. Now, there are several blood tests that can be used to assess PFAS exposure and potential health effects. And these tests can help measure the levels of PFAS compounds in the blood and evaluate any associated risks that you might have. And here are some of the commonly used blood tests that we can use for figuring out. Well, there is a test called total PFAS. This test basically measures the concentration of PFASs in the blood. Now, there are target-specific PFAS compounds such as perfluorooctanoic acid or perfluorooctane sulfonate, and these tests can determine the level of individual PFAS and compound in the blood. But in absence of doing these special tests, one of the things we can look at are the liver tests, the ALT and the AST. When they are elevated, these two liver tests, and you're not really overly clear what it's coming from, then you have to start considering, what this could be. Well, the lipid profile on PFAS compounds have also been found to accumulate in the blood, lipids, the fats. Kidney function can be bothered too, the BUN and creatinine. And of course, other than avoidance, use of both oral and natural substances that support phase 1, 2, and 3 liver detoxification should be clearly in your vocabulary and thought process to get rid of these. And of course, for yourself and families, get rid of the non-stick cookware, water-repellent clothing, stain-resistant fabrics, and particularly foods that are packaged with materials that have this. Stay away from landfill and waste sites. They are contaminated. And that might contain, firefighting foam landfills as well. Certain types of shellfish and other seafood may contain elevated levels of PFAS due to this accumulation into our body or accumulation there as well. What I'm saying is they're basically pervasive. They're everywhere. You've got to be aware of them, and they will and can affect pretty much most of the organ systems. Without consideration for these, you may have a difficulty getting to the point of gaining optimal health. Thank you so much for watching. I'm Dr. Mitch Ghen. For further information, go to drmitchghen.com. That's DrMitchGhen.com.